Lady Abby is back again with her welfare check, making sure we are all doing well. Hope we're all doing well this morning. Back to my real job, to promote health. I will continue to promote health this week, like I always say. So this morning is just checking on everyone to make sure we are all doing okay. So back on the weekend time, you see Lady B in actions in terms of socializing aspect and paparazing. But at this moment, like I said yesterday, is just continuous health promotions. I will be promoting health. Like I said, this week is week of promoting health. So the voice you're gonna hear is actually a hair promotion I did for my classmates some time ago. So you will hear my voice, the voice of Lady B promotion.
Today, I want to share my knowledge with regards to stroke to create awareness. And the topic I tend to cover is to do what is stroke, signs and symptoms and causes and risk factor and complications of stroke. So, I will start off to say, what is stroke? Stroke for me is a brain attack. And you can imagine when our brain is being attacked, what is happening. A stroke, if you think about it, is an interruption of blood supplies to the brain. So either there is not enough blood supply getting to the brain, thereby denying brain tissue from oxygen and nutrients, which causes brain cells to begin to die. Once the brain cells are starved of oxygen for about 4 to 6 minutes, they begin to die. Can you imagine? Can you imagine that? So if you think of this, then I will say that in that case, every organ in our body, brain is the most jealous lover, the most jealous organ of the body, because if anything tamper on each side of the brain, it dies. So we are not going to allow that to happen. So that is why I'm doing this, for all of us to know the importance of brain in our body. Also, when the blood supplies to the brain is too much, it also causes stroke too. So that is why we need to take absolute care of our health and also to our loved ones' health. Stroke can happen to any one of us, anywhere, anytime. Stroke is a medical emergency and it needs immediate treatment, very crucial. Early action can reduce brain damage and other complications. If we catch it quick, it can help us reduce this. So therefore, I'm gonna be looking at the anatomy of brain so that it will give us a little bit of insight of why is it important that brain is a jealous organ. So the front, I will be looking at the brain is actually sectioned into 5 lobes with the stem. So the front side of the brain is called frontal lobe, which handles our behavior, motivation and movement. Then it leads to the temporal lobe by the side, which handles our emotion, our memory and understanding, and the parietal lobe at the center of the brain, which handles our sensation and perceptions, our views. It helps us to make views. And occipital lobe, close to the back of the brain, which handles our understanding in what we see today. Then that takes us back to the cerebrum, which handles our balance and coordination. It is at the back. Then there holds the brain stem close to the neck. And that's why you can never allow anybody to hit you on the neck. So in Igbo language, we call it ekwisi. Don't allow anybody to touch your ekwisi. It handles, that is where every essential things in the brain functions, where the essential life functions. I call it in my language oga kpatakpata, ekwuchagu. So not only that, so I did a research and I came up to see that most of the research have said and have shown that we Africans are prone and at risk of stroke because of our lifestyles. So just like I've mentioned before, where the brain, where it's important for us to maintain our brain, so that nobody hits you in any part of your brain. So in that case, can you imagine how could if the stroke actually affects any part of our body? Like I said, a stroke can occur very suddenly and symptoms can be severe. It can affect how your body works, how you think, how you feel, how you learn, how you communicate, but not all stroke are the same. The effect of stroke depends on the area of your brain which has been affected, how severe the damage is, and your health before the stroke. Were you okay before? Were you healthy? Some people have blood pressure, some people suffer with other health conditions. So in that case, many people make good recovery if they have stroke, or most people are left with some sort of long time problems or disability, so they don't recover quick. So that is why I decided again to look at, if part of your brain is damaged. Let's say if you are the damage to the right side of your brain, it can cause physical effects on the left side of your body. It makes you very difficult to remember things, difficult to concentrate, you are restless, problem with spatial awareness, problem with movement of your left side. Then if it's a damage on the left side of your brain, it can cause you physical effects on the right side of your body. So in that case, difficult in understanding people when they're talking, difficult in speak, difficult in writing and reading, problem with movement of your right side. I've said this before. So in that case, it's important for you to look at the symptoms, to look at people every time, monitor them, like our grandmothers, our nephews, our uncles, that are aging, even the young people. Look at them, look at the symptoms in order for you to recognize when the stroke is coming. So you look at their face. Is for example, if the facial weaknesses is there, can the person smile? Has their mouth and eyes dropped when you are talking to them? Can they raise their hands if you ask them to raise their hands? Can they raise the both arms? Can they speak to you without any problem, without the person not speaking clearly? Can they speak clearly? Can they understand you when you are talking to them? If you cannot, if you recognize these symptoms and you find that one is having it, please call for help. Take the person immediately to the emergency hospital. For where we are, we will call emergency immediately, and the ambulance will tell us to perform all those symptoms. And once we tell them is actually visible, they will call an ambulance. Within a minute, ambulance is there, to take the person to the hospital in order to prevent the brain from hemorrhaging, from blood clotting. So in that case, it's important, please watch out for all these. If you cannot find or if you notice all these symptoms, there is a problem, run. So, and that will lead me for me to go now to tell you about the different types of stroke. So I'm going to talk about three different types of stroke. Mainly is called ischemia stroke. This is most common type. It occurs when the when brain's blood vessels have become narrowed or blocked, thereby causing severely reduced blood flow, which is called in terminology, medical terms, ischemia. When there's not enough blood, enough oxygen. So the blockage of the narrowed vessels are caused by fatty tissues. It caused by all these fatty tissues deposited in our body, in the blood vessels, or it can be blood clots or other debris that travels through the blood stream and then lodge in the brain blood vessel, which then causes stroke to occur. Can you imagine when all these things are blocking our blood vessels in the brain? So the next one is the hemorrhagic stroke. This type occurs when the blood vessels in the brain leak or rupture. Brain hemorrhage can result from many other blood vessels condition or diseases. Like I've mentioned this before. Yeah, so that's why we need to run quick. The third one is a transient ischemic attack. We call it TIA. This is known as mini stroke. When we say that somebody has got a mini stroke, so this type occurs as temporary temporary reduction in blood flow to the heart of the brain, which may last at a little as 5 minutes. It is a temporary period of symptoms similarly to those you could have in ischemic stroke, when there's a short of blood supply. So TIA does not cause permanent damage to the body, unlike other part of stroke. So that is why it's important for us to know the three types of stroke. So then I will go through again to talk about the complications and all these and devastating effects of stroke. A stroke can sometimes cause temporary or permanent disability. The effect depends on where it takes place in the brain, like I've said before, and how long the brain lacks the blood flow to the affected areas. That is why, like I previously mentioned, don't allow anybody to tamper with your head or your neck. Some complications are the weakness in the arms, the legs, the problem with speaking, understanding, reading and writing, swallowing problems, vision problems, eyesight problems, losing bowels, bladder control, like going to toilet, peeing, and the severe pain and headaches, and the tiredness, we call it fatigue, that never go away even when we has already rested. Problem with memory and thinking, the numb skin, when you touch your skin, it's not like as if it's numb, it's not working. There's a problem. Emotional problems, difficult in controlling your emotions, you are restless, you are stressed, you can't concentrate, is a problem. So in that case, this will lead to depression as well. So you can imagine all these complications leading to stroke. So that is why we need to be aware of the risk factors as well. Many factors can increase the risk of stroke. We have modified and non-modified risk factors. The modified risk factors, which can be controlled on potentially treatable. Example of it is high blood pressure, known as hypertension. High cholesterol. Cholesterol is a fatty substance in the blood vessels. And the diabetes type 2, a condition that causes a person to have blood sugar level in the blood and it becomes high. And being overweight as well, smoking and alcohol consumption, lack of exercise. You can imagine all these risk factors, what it can do when we don't have a preventative measure up to prevent it. So the non-modifiers is the age, between 20 between 20 to 75 age. Ethnicity, like we know, like I said before, the research showed the Africans are at risk of stroke. The gender is mainly affected for male. The diabetes people are also at risk, type 1 diabetes. And the history of heart disease, like I said, if you're suffering from heart disease, can you imagine? So these are the things. And what are the causes of stroke? There are two main major causes of stroke. Number one, the blocked artery. This could be as a result of clots, fatty deposit, like I've said, or debris in the vessels to the brain. And the leaking of boosting of the blood vessels. This could be as a result of uncontrolled high blood pressure, over treatment with blood thinner known as anticoagulants, if it's over treated, or as a result of bulges of weak spots in the vessels wall, aneurysms. So these are the things we need to be aware, in order for us to prevent from not having stroke. So in that case, I'm creating this awareness because it's important for us to understand all this, my sisters. If you understand it, we'll be able to manage it well, or then to treat it well. So prevention is better than cure, like we usually say before. So the major strategy for in prevention is to truly consider the lifestyle changes, to engage in physical activities like exercises, as it can lower the blood pressure. To do healthy eating, eat well and watch your weight. Mind what we eat and cut down on fatty tissues, which is causing us the high cholesterol, and cut down on alcohol and tobacco intake. If you are a smoker, please cut down because of the coronary heart disease, and control the your blood pressure if you're having blood pressure, because most people who has blood pressure always end up having stroke. So please, even people with like I've said, I've mentioned it before, with diabetes. So these are the things we need to know in order to as well, to understand how to deal with stroke if we come across the symptoms or if we are involved in it. So in that case, we need to monitor how we can how we can reduce this. So in that case, my topic is finished. So goodbye. God